Okay, welcome to the Nations of Sanity. It's my great pleasure to welcome Dr. Michael Edelstein, who's a clinical psychologist and who has been very kind to take the time to speak to me today about his work, and we'll be discussing a few subjects hopefully over the course of this conversation. So before I start, I just want to say thank you, Michael, for taking the time to speak to me today.
Well, thank you for inviting me, Matthew. I'm happy to speak with you.
Thank you. I've been looking at a lot of your work lately. I've listened to a few of your interviews and talks. You touched on a lot of great subjects, but before we go into them, I just wondered if you could just, for anybody listening to this, just introduce yourself a little bit and how you got into, both from your work point of view, from a professional point of view, and also how you got into libertarianism.
Okay, sure. I was the founder of the approach I use is Albert Ellis, and the approach I use is called REBT, or Rational Emotive Behavior Therapy, and it's a type of psychotherapy that's present-oriented. The therapist is active and directive, which is very different from traditional therapy, which involved encouraging the clients to talk more, express their feelings, talk about their childhood influences and those kinds of things. And the REBT has an entirely different view of emotional disturbance, and that is our current emotional problems, anxiety, depression, anger, procrastination, addictions, don't come from our childhood, but comes from our thinking in the present, our views, attitudes, beliefs, ideology, what we tell ourselves right before we get ourselves disturbed or act in a self-defeating way is the cause of these problems. So when I was about 18, I had a lot of these problems that I was just mentioning: depression, anxiety, insecurity, procrastination. And I started to see a therapist who was a more traditional therapist, and I saw him for almost a year, and it didn't really help that much. He asked me, how do you feel and why do you feel that way, and tell me more about it. He was very nice and warm and accepting. I enjoyed speaking with him, but in between sessions, I had nothing new to do or ways to look at things to help myself. So then I came across Albert Ellis. I heard him on the radio, and I read a book of his, and he was very outspoken about his criticism of these types of therapies and his approach, and it made a lot of sense to me. Unfortunately, he had his practice in New York, and I was living in New York at the time, so I started to see him as my therapist, and that dramatically changed my life, not only personally, but I was taken to the therapeutic approach so much, I thought this would be a good field for me to become a therapist. So that's how I got into all this. And then in terms of libertarianism, as a result of seeing Albert Ellis, I had a few friends who were seeing Albert Ellis, and one of them introduced me to Walter Block, who was also a client of Albert Ellis's. He lived near me in Brooklyn, and we got together to play chess, and in between chess games, we debated politics. I was a liberal Democrat at the time, and he was a rising star in the libertarian movement, and over the course of 2 years, he converted me to the freedom philosophy. So that's pretty much my history in terms of both those, my professional life and also one of my main interests avocationally.
Excellent. With regards to your sort of conversion to libertarianism from being a liberal Democrat, so would you say you were kind of basically left-wing before moving over to sort of libertarianism? Did you find there was sort of, what areas were there that was, I assume there was some, perhaps like some common grounds that you had with Walter before he converted you fully? What were the sort of stepping stones, for want of a better description, that kind of got you there from where you were as a sort of left-wing liberal Democrat to moving into sort of libertarianism and voluntarism and that kind of thing?
Yeah, that's an interesting question. And I would say the largest stepping stone was I was interested in the idea of freedom, people being free. And also I was interested in people benefiting and prospering and peace. Um, I think for a long time I was against war. So those were some stepping stones. And then I also like to look at things logically. So Walter was taking me through a whole bunch of issues: poverty, crime, um, war, uh, drugs was another one. I believed as a liberal Democrat in no restriction, no government restriction on drug selling or taking. And and he took me through these various areas and showed me how freedom and no government involvement would benefit people and would be logical from a logical perspective, logically consistent. So that was pretty much the steps.
Yeah, I mean, I found myself when talking to people, both left wing and right wing, because there are some sort of stepping stones from both directions towards libertarianism and for what I consider the end goal there as voluntarism or anarchism, as it's sometimes referred to. I mean, and again, like you say, it's the logical thinking, because a lot of the principles that many people already believe, I personally find, just in my own encounters with people and talking about this sort of subject, that it's often about just getting them to take principles that they already believe in and just applying a sort of logical consistency to the application of the principles. Like, if you speak to most people, they can understand. Like if you explain basically like the non-aggression principle to them, and you talk about the things that are violations of the non-aggression principle, like the obvious things like theft and murder and rape and assault and all these sort of things, and obviously most people agree with that, but sometimes I find the best approach is to talk about the underlying principle, like why are all these things wrong? What's the common principle behind why all these things are wrong? And I think that's what reveals the non-aggression principle. And then you can kind of take the beliefs that they already have and just show them how, if they apply them consistently, it kind of sheds light on other issues that they perhaps haven't thought about quite as complexly.
Right. Yeah.
Another thing I found very interesting when I was listening to some of your work was regarding Ayn Rand. I don't know if I'm pronouncing her name properly, actually, but I mean, because I've got a little bit of a conflicted view of her. I mean, she's obviously done a lot of good work in regards to describing the non-aggression principle. I also find she's done a lot of work that, for want of a better word, is a bit sort of damaging to the movement or the appearance of it. One of the things I kind of disliked about her presentation of the non-aggression principle, apart from some of her descriptions, one of the descriptions I remember her giving, she referred to physical violence. The non-aggression principle prohibiting physical violence, and I thought, well, that's kind of misleading, because that kind of suggests that things that don't involve direct physical violence, like theft and fraud and stuff like that, wouldn't be violations of the non-aggression principle, when of course they are. And the other thing that I think is one of the misconceptions many people have about the non-aggression principle in particular, and sort of libertarianism and voluntarism, is the idea that just because we oppose the use of the coercion of taxation or state violence in any other form to facilitate certain programs doesn't mean that we necessarily oppose those things. And obviously, because Ayn Rand was very much against sort of the charity ethos and was very much a proponent of selfishness as a virtue, I sometimes think that her views on that sometimes get conflated with what the non-aggression principle is all about. And the non-aggression principle doesn't oblige people to help each other, but it doesn't speak against it either. And I think it's one of the things that's important, that people don't assume that just because we don't want to rob people to provide care for people doesn't mean we don't want to provide care for people. We just think that they should be done through voluntary means.
Yeah. Well, I'm not an expert on Ayn Rand. this is just a hobby of mine. My area of expertise is psychology, so my interest in Ayn Rand and Nathaniel Branden, who was her spokesman for quite some time, is their attachment to the whole self-esteem concept. And I've given many talks and interviews on why Ayn Rand's concept of self-esteem is unreasonable. So that's the main thing about Ayn Rand that I can really speak about.
Sure, yeah, I understand that, and yeah, I mean, I found that very interesting as well because I mean, obviously, I'm not a psychologist myself, so but it was a very interesting take. I mean, could you perhaps just sort of explain that for people listening? I know there's obviously other videos where you go into more detail, but could you just give perhaps a brief overview of that now for anyone listening?
Yeah. So to start the discussion, let's define self-esteem. That was a big thing of hers. So to esteem something means to think highly of it. So self-esteem means to think highly of oneself. Now, normally people think highly of themselves when they do well at important things in their life, and they think lowly of themselves when they do poorly. And I work with anxious, depressed, insecure people who often have low self-esteem because they're doing poorly as they see it in life in different ways, at work or in relationships or in meeting their own standards. And so they feel, I did poorly, therefore I'm a poor or worthless person. So what they're doing is they're evaluating their total selves. I'm no good, I'm worthless, based on their behavior, which could very well not be good or be subpar. So it's fine to evaluate your behaviors. In fact, it's important to evaluate or rate your behaviors, because if you decide you're doing well, then you want to maintain that. And if you decide you're doing poorly, normally you'd want to improve. So that gives you sort of a steering point for moving ahead in the future. But there's really no point in then generalizing to your total self, rating your total self based on that rating, and saying I'm a good person or I'm a worthless person. So that's the main point, and my main criticism of anybody's form of self-esteem, including Ayn Rand's and Nathaniel Branden's idea. Now, Nathaniel Branden claims that he's against self-esteem also if you base it on inauthentic types of things. So he has authentic self-esteem, which is based on what he thinks are good behaviors and important behaviors, like being responsible, being assertive, having integrity, being honest, those kinds of things. So if you do well on those things, then it's okay to give yourself high self-esteem. But it's still the same fundamental problem, rating your total self, your essence, your being, your personhood, based on the rating of your behaviors. So that's pretty much the idea of self-esteem and my criticism of Ayn Rand's concept of it in a nutshell. Does that make sense, Matthew?
Yeah, and I mean, definitely, and I think it's probably quite an important thing for people to take note of, because, as you say, if people let them sort of judge themselves as a whole based on, like you say, it's important to judge your actions and to recognize when you do wrong. But obviously, if you let that cripple you mentally, when you sort of appraise yourself as a person and your self-worth, then it becomes quite crippling. So, yeah, I mean, I think that's a very interesting perspective and important way to look at it. And I mean, the distinctions that you mentioned. Sorry, who was the other person you mentioned? Not Ayn Rand. The other.
Branden.
Yeah, I mean,
Branden was a psychologist who worked with Ayn Rand for many years, and he's written a number of books on self-esteem. They did have a break later on in their relationship, but he, even after the break, he was still very big on self-esteem and the importance of self-esteem.
Yeah, I mean, because the distinction you mentioned that he made seemed rather arbitrary, between, as you say, the fundamental flaws still there, that you're still judging yourself as a whole based on, sort of like this little snippet. So, So yeah, another
It may,
thing.
by the
Sorry.
way, Matthew, it may not necessarily be a little snippet. You could get fired from one job after another and be scraping the bottom of the barrel in terms of your finances. Uh, so that would be a pattern of behaviors. Or you could be addicted to alcohol and your life could be going down the drain, which would be a large part of your life. But again, to convince yourself that you're a bad person, you're a loser, you're no good, based on this poor pattern of behaviors doesn't make sense, and it tends to make things worse.
Yeah, no, I can see how that can be self-destructive. Um, another issue, another thing I've heard you speak about, which was of great interest to me, particularly with what I'm doing at the moment, was the issue of sort of stage fright and sort of overcoming kind of introverted tendencies, which spoke to me quite a lot because just doing something like this is in many ways quite unnatural to me. Having a conversation as we are is perfectly natural to me, but the whole podcast setup and everything like that was something I very much had to kind of push myself into. So I found your work very interesting on that. Could you speak briefly about the 3-minute therapy that you're involved in?
Yeah, the 3-minute therapy is really REBT, rationally motive behavior therapy, which I learned entirely from Albert Ellis. And I just repackaged it as 3-minute therapy as the title of my book, 3-minute therapy, to make it seem a little more palatable and interesting to the lay public than calling it rationally motive behavior therapy, for example. And the main idea is that our emotions don't come from situations themselves, although people, just about everyone, thinks our emotions come from situations. So if I win the lottery and I'm happy, most people would say I'm happy because I won the lottery. Or if I get fired and I'm unhappy, most people would say, well, it's obvious I'm unhappy because I got fired. But that's not how we work psychologically. The way we work psychologically is it's never situations themselves that cause our emotions, but rather it's our thinking about it, what we tell ourselves. So if I get fired, it's because I'm telling myself about that situation. This is bad. This is no good. Now I don't know how I'm going to pay my rent. I'm in trouble. So it's that thinking that causes me to feel sad or disappointed about getting fired. Or if I win the lottery, the reason I feel happy is not a direct cause of winning the lottery, but rather it's because of my thinking, what I'm telling myself. Isn't it great? I won the lottery. Isn't it wonderful? Now I can buy a house and I can do some traveling and I can retire. This will be a wonderful life, etc. So it's those evaluative statements we make to ourselves that causes our emotions rather than situations themselves, which we're making evaluations about. Now, when we have disturbed emotions like anxiety, depression, anger, guilt, shame, or self-defeating behaviors such as procrastination or addictions, that also is generated by our thinking, but by a particular type of thinking. That's thinking in terms of absolutes, demands, fictions, demands such as, I must do well and get approval, and I'm no good. Or because I would like you, I prefer you treat me well, you absolutely must treat me well. And because you're treating me poorly, you're no good. And because it would be lovely if life were fair, easy, and hassle free, therefore it absolutely must be. Life must treat me in a fair, nice, kind way. And if it doesn't, if life is unfair, then it's awful and I have to be miserable forever. So those are the kinds of thinking that leads to emotional disturbance.
Mm.
So there's a difference. Now, not all negative emotions are disturbed emotions. So if I lose my job, it's appropriate to have certain negative emotions, which is sad, sorrow, regret, frustration, disappointment. Wouldn't want to be happy about losing your job normally, So it makes sense to have those emotions. What I'm talking about, what I help people with, are disturbed negative emotions, not helpful negative emotions, such as the ones I mentioned: anxiety, depression, anger, etc. So that's an important distinction to make.
Sure, yeah. I mean, just going back to your point with regards to, like how we think about things, um, playing the larger role than the events themselves. I mean, one of the things that's sort of further evidence to that, you mentioned obviously like a lottery winner would be happy because they think about all the positives, but obviously there's a lot of people that get depressed when they win the lottery, which kind of, sort of further evidence to your point in regards to the fact that,
Right.
because you can have the same event and, one person, it could be the best thing that's happened to them because it can free them from a soul destroying job, and it can, and they could perhaps do a lot of things with it, and then other people might lose their motivation and it could be the worst thing in the world, and
Exactly.
the variable there is like you say, how they're thinking about it. So
Right. Yeah. There's So it comes down to subjectivism, what you tell yourself subjectively, and that's a very powerful idea with helping people with emotional disturbance, because if it's your thinking that's the problem, not your dysfunctional childhood or how your mate is treating you, but your thinking, if that's what causes your disturbance, then you do have some power over changing your thinking and thereby changing your emotions.
sure, yeah. But I mean, also you did mention about the fact that, like, obviously in many instances, it would be quite right or expected or perhaps normal or healthy. I don't know what the best description you would give, to feel a certain way about certain things. Like, for example, if you lost your job, it's right that, that would obviously be something that would stress you to some extent. So is there a sort of a balance to be found there with regards to that, or do you just sort of go full ho with regards to trying to get people to put the think things in a productive way?
Well, yeah, well, normally anxiety doesn't help. Stress about losing your job doesn't help. It's not going to help you get your job back or get another job or enjoy life as a retiree. So I don't see any benefit in it. And my view and the RBT view is that all anxiety and stress is unhelpful and tends to make things worse. And all anger, resentment, hostility is self-defeating and destructive, so that doesn't make any sense. And all addictions don't make any sense either. So to answer your question, Matthew, I think we do go the whole hog and try to help people give up these disturbed emotions entirely.
Yeah, I'm reminded actually of, I don't know if you've seen the film Bridge of Spies.
Yeah, I saw that. Yeah,
Yeah,
I
there's
could quote it. Yeah.
the character in there where, I don't know if you remember, where Tom
Yeah.
Hanks keeps asking the guy, "Do you ever get worried?" And he just says, "Would it help?"
Yeah.
And that just reminded me of that when you when you were speaking about that.
Yeah, Tom Hanks is the lawyer, and he tells his client, I don't remember the actor's name. He said, the jury could convict you, and that might mean you'd be executed. And Tom Hanks looks at the guy and he says, "Well, are you worried?" And then the guy says, "Well, would it help?"
It speaks to your point perfectly, though, doesn't it?
Yeah.
Because, as you say, in many situations, I mean, is there ever a situation though where, because obviously, a lot of these reactions, there is a sort of, a natural origin to them, and in many ways they serve a destructive function now, but there is also surely a certain usefulness to some of these emotions and feelings, like, I mean, all I'm asking, I suppose, is there a danger of going too much the other way in regards to, you know, um, is a little bit of stress good to kind of keep you on your toes, so to speak?
Well, I think it's good to be very alert, vigilant, determined, passionate to keep you on your toes. But again, stress sort of falls off the deep end, and you could be very passionate about things and determined without being stressed, just being very unhappy about the situation and determined to try to change it. And that comes from strong preferences rather than demands. I strongly prefer to get a good job, so I'm going to work 40 hours a week to try to do one, because if I don't, then I have great disadvantages. And if I do, then I have advantages. So that strong preference is a motivator, an incentive to work hard at things. But if you make it into a must and you get depressed about being out of work, then that's normally not going to help.
Yeah, I can see how that can be destructive. Just switching over to, that's kind of sort of staying a little bit within your field, but also touching on the libertarian issue of things. I heard you speak before about how you've seen sort of government interference causing problems in your field. I wondered if you could just sort of elaborate on that a little bit.
Well, one of the main problems is requiring a professional license to practice as a psychologist. And in order to get a professional license in the US as a psychologist, it means getting a PhD, which is a long, hard road to toe in terms of schooling and expensive. So that cuts a lot of people out who could be very helpful. And then there's licensing exams. So first you become a psychologist as a result of getting a PhD. And then in order to practice, it means being licensed as a psychologist. So that goes further in terms of expense and study, and then taking an exam, which often is not directly related to the practice of clinical psychology as I practice it. So that blocks a lot of people. And in a way, it benefits me personally, because the less competition I have, the higher my fees could be. But overall, as far as society is concerned, I think it makes things much worse, because I know talented people who know the approach that I use, rational emotive behavior therapy, who would be great therapists, and they're kept out because of this.
Yeah, I've seen also. I mean, obviously I don't know, much about your field, but I'm sort of just looking outside. I've also seen how drug development, not just in your field, but in the medical field in general, has been, massively hampered by government interference. And I know sort of more recently they've been looking into things like psilocybin for depression on a microdosing level, which is the ingredient in magic mushrooms, for anyone who doesn't know. Obviously, cannabis is becoming much more well known for its medical value, both within your field and also far-reaching areas of like cancer and epilepsy and things like that. So that's obviously from something that I've observed, and something that's caused a great deal of harm has been government interference with regards to drug development, and also the imbalance they cause within the market on that, with regards to the price increase of drugs because of the regulations involved and the licenses. And as you say, just as you spoke about with regards to the extra cost involved for yourself, this sort of goes across everywhere. Yeah, they just seem to make everything harder and more expensive than it needs to be by quite a considerable amount. And it doesn't surprise me to hear you speak similarly of your experiences, but it seems to be something that just infects kind of all walks of life, really.
Right. Also, another aspect to this is that because you're required to have a license, I think the general public assumes that if someone has a PhD and a license, this means they're competent and they'll be a good therapist. So it discourages them from thinking critically, and then they'll go into therapy, and no matter what kind of therapy they get, they'll think, well, this is, this doesn't make sense to me, but what's wrong with me? This person's a licensed psychologist, so he or she knows what they're doing. So it gives the veil of competency to all psychologists, however incompetent they may be.
Sure, yeah, no, I can see how that would sort of diminish the diligence that people would exercise by quite a considerable amount as
Exactly.
well.
Yeah.
Yeah. So, um, what I mean, when you sort of deal with people again, just going back to sort of the stage fright thing. I mean, what's the sort of do you kind of encourage people to just kind of dive straight in with stuff like that, or is it something that people, what's the kind of approach there with regards to overcoming stage fright? Is it sort of is pushing yourself in kind of like the best way to go, or can that be sometimes not the best move? Is a little bit of caution sometimes better exercised?
Yeah, that's a good question, Matthew. And in cases like this, I explain the problem separation technique, which is step one. And problem separation technique says, as we go through life and as we go through the day, we have various goals and challenges and preferences, things we'd like to accomplish. And then we try to figure out how to accomplish it. So, for example, a very simple example would be, let's suppose I want to get up at 5 a.m. the next morning to get to work on time. So I have a practical problem. How am I going to do it? I could use an alarm clock to get up at 5 a.m. I could ask my wife to wake me up at 5 a.m. I could go to bed very early to make sure I don't oversleep. So there are various practical solutions for me to work out and decide how I'm going to approach it. So that part is called the practical problem. But then, being imperfect humans, we often escalate our practical problems into emotional problems. So I might start getting anxious the night before about oversleeping, or I might start feeling dread about facing the day and facing the job I don't like, or I might start procrastinating about getting to bed on time, etc. So those are emotional problems. So that's the problem separation technique. Decide what's the practical problem and what's the emotional problem. And the reason why it's important to make that artificial distinction is because when we determine what the emotional problems are, like with stage fright, anxiety about giving a talk would be an emotional problem. So we use a special emotional problem solving techniques to address that. And in order to address the practical problem, be a good speaker, then we use practical problem solving strategies such as join Toastmasters, practice giving talks, etc. So to answer your question, the first step is what's the emotional solution, and then what's the practical solution. So I could address each if you think that would be useful.
Yeah, I'd certainly be interested in hearing that. I mean, just to sort of with the practical solution, is that kind of a case of practice makes perfect a little bit with many things in regards to giving you that extra confidence because you've done it many times, and is it sort of along those
Yeah,
lines?
that's part of it. The more you practice, the better. And one of the things I recommend to clients is Toastmasters. I think there are Toastmasters all around the world. Have you heard of Toastmasters, Matthew?
No, I can kind of half guess what it's
Yeah,
about, but
right.
giving toasts, I
Yeah,
presume.
giving it what it is a group that gets together periodically, usually once a week, and then each person has a chance to give a little talk to the group, and then the group gives them feedback on how they did and how they could improve. So that's the outline of Toastmasters. So I encourage my clients who want to be better speakers to go to Toastmasters. Um, so that's one way to do it. Now, if people are very, very anxious, sometimes they may not want to jump right in and start giving talks at Toastmasters. So this answers your question is, do you go all the way or do you take it one step at a time? So it's up to the person. It's really an individual decision. And if they'd like to take it one step at a time, then we determine what causes their anxiety. And often what causes their anxiety is the need for approval. And that comes from thinking. It doesn't come from the possibility of being disapproved of when you give a talk, but it comes from how you view that. And normally how you view it is because I would like to give a good talk and be accepted by these people. Therefore, I absolutely must, I have to, there's the demand. And if I'm not, then this proves I'm a worthless loser. So they can start addressing that with one other person. They don't have to start with a group by, for example, when they walk down the street, they can stop a stranger and ask for the time, or they can start a conversation. And often people have a fear of stage fright, have anxiety about doing that. So that would be a smaller step that they could start with. So that's one way to do it more gradually. Also, I give them cognitive exercises to work on to help them change their thinking, even when they're not scheduled to give talks. And the way that works is I recommend my 3-minute exercise form. And the purpose of that form is to help people identify their problem and come up with a better way to look at things. And that consists of an A, B, C, D, E, F format. So what they would do is they would write, A stands for activating event. Activating event means a situation you might be in where you feel anxious. So A could be, I'm about to give a talk. And then B would be irrational belief. I must give a good talk, and if I don't, I'm no good. And then C is undesirable emotional consequence, which in this case is stage fright. So A, I'm about to give a talk. B, I must give a great talk. And C, anxiety. So one of the points here is B causes C, I must give a great talk, causes the anxiety, not the A, not giving the talk or not even disapproval at A. So then we go on to, that's the diagnosis part, then we go on to D, E, and F, and D stands for disputing or questioning the irrational belief. So we take the irrational belief at B, I must give a good talk, and we turn it into a question to look for the evidence, because we try to be little scientists here and see if there's evidence for hypotheses, and that's what D does. So D would be, what's the evidence? I must give a great talk, and I'm a loser if I fail. So just that question, and that sets us up to look for evidence, and that leads to E. E is effective new philosophy, or the answer to the question. And if you think about it, there are no musts, there are no shoulds, there are no losers. There are just imperfect humans who act imperfectly and don't live up to their goals, values, and preferences. So then they write things like that in E. Although I prefer to give a good talk and get approval, there's no law of the universe saying I absolutely must. It would be disadvantageous to give a poor talk, but hardly the end of my world. If I do give a good poor talk and people disapprove, that only proves about me at the very worst that I'm an imperfect human who acts imperfectly, never a worthless loser. I don't like doing poorly at a talk, but I definitely can stand, I can bear what I don't like. I've survived rejection in the past, so obviously I'll survive it in the future. The more I pressure myself to give a good talk, the more anxious I'm likely to make myself, and the worse the talk is likely to be. And it's not the possibility of falling flat on my face, or getting rejection that causes my anxiety, but rather it's my irrational must and should thinking about it that's the problem. And with practice, I can change my thinking. I can still have a happy life, even if I give poor talks forever, although I might be much happier if I gave great talks. So those are some examples of E statements, effective new thinking or effective new philosophy, and then that leads to F once you internalize it, and F is concerned about doing poorly on the talk or giving a poor talk, but not anxious or worried or nervous about it. So B leads to C, the musty thinking, the shoulds lead to anxiety, but E leads to F, rejecting the musts. There are no musts, there are no shoulds, just our subjective human preferences leads to new, more appropriate feelings. Now, I usually have clients write this out with my guidance in a first or second session, but that's not going to cure them, obviously. What's going to cure them is by using the same learning principle that we use to learn most things, and that says practice and reinforcement of the royal road to learning. So we come up with a homework assignment for them to write out these 3-minute exercises on a regular basis. Once a day, twice a day, 10 million times a day. I tell them if they write it out 10 million times tomorrow, they'll be cured. But usually they come up with once a day. So again, it's the practice and the reinforcement that makes all the difference. And as long as what they write is meaningful and not pie in the sky wishful thinking, it's important that it's meaningful to them. The more they do it and think it through and see the truth in it, the more their thinking will start to change and the less they'll have these demands, the musts and shoulds on themselves and just preferences, and therefore less anxiety.
I see. So it's kind of like basically changing the way they're thinking about it in a way that makes could potentially at least make the difference between them being able to persevere and improve and them just kind of giving up altogether because they feel like it's just damning on them as a person.
Exactly, and because they feel they're just facing this wall of anxiety, which they can't bear, so they give up for that reason also.
Yeah, and just touching on what you said about pie in the sky, obviously avoiding kind of that. Do you mean like with regards to sort of setting too high, unachievable goals, or?
No, pie in the sky means if they write an E, all this proves about me is that I'm an imperfect human who acts imperfectly, not a worthless person. They may say, but I am a worthless person. That doesn't make sense. So that's sort of pie in the sky wishful thinking to them. So unless they see the deeper meaning, why they never could magically turn into a worthless person, why they're always just an imperfect human who acts imperfectly, no matter how poorly they act, they're still the same Joe or John or Matthew they were before the talk as they are after they fell flat on their face. They didn't dissolve into a puddle. The more they see the truth in that, the more meaning it has and the less pie in the sky-ness it has.
Yeah, I understand that. Yeah. Do you find that your insight into the way people think helps you with regards to when you're talking about, sorry, just jumping back onto libertarianism and voluntarism, that do you find that helps you with regards to when you speak to people, like sort of understanding how best to speak to them about certain things, or would you say that your own experiences and your own journey is actually more useful, or is it kind of a bit of both?
Well, it does help me speak to people because if they come up with views that I think are quite ridiculous or make no sense, I'm less likely to dismiss them as stupid people, and I'm less likely to get angry if they disagree with me or even get angry at me because of my views. I'm less likely to get angry at them because I don't have this demand that they must be reasonable and rational all the time. I see they're imperfect humans who act imperfectly, so getting angry at them really doesn't make any sense and only rips me up inside. So that helps greatly. Also, I know that people although they don't have to have, they like praise and positive feedback and compliments. So when I speak to people, I try to find some things that they say that I agree with and say, very good, that makes a lot of sense, but what about this? Or if none of it makes sense, sometimes I'll say, well, I appreciate you persevering in this conversation. A lot of people would have given up beforehand. So that helps because people really like approval, even though they don't have to have it, they don't need it.
Yeah, like you say, you don't want to be dishonest, and you still want to be honest with your feedback. But sometimes people are more willing to accept criticism and certainly see it as constructive if you accompany it with positive feedback as well. And obviously, if you can find some genuine things where you can say, well, You know, like if you can sort of you know, commend them on a valid point here, but sort of say, but I think you've gone wrong here. I think that helps them to not see the conversation as combative, and more something where you're both trying to help each other understand. You know, I think it helps add a bit of goodwill to the conversation, which I personally find is imperative, because without goodwill, it's so easy to talk past each other. And I mean, we spoke before, when me, you and Walter spoke about how, you know, defining terms is so important, because you know, and I think it was when you were speaking to Anarcho the channel, I think it was, you mentioned. Yeah, that's it. Yeah, and I think you were talking then about, like, for example, when, say, someone from the left wing is talking about capitalism and they're criticizing it, they're talking about state capitalism, and then when like a voluntarist or a libertarian is talking about it, they're talking about laissez-faire capitalism. And when you actually sort of delve into what those two things mean, they're totally separate things. They almost couldn't be further apart. I mean, there's perhaps a few little crossovers with the capitalism side of it, but you know, it's so different, and both sides just end up straw manning each other. I think, although sometimes even with goodwill, that, you know, this can be some unintentional straw manning, because people genuinely do misunderstand each other, and we come from different you know, perspectives, and use different languages. Use different language and words to describe things. I mean, even when you said gave me feedback with regards to, like, my description of the non-aggression principle, and talking about the prohibition of harm, and pointing out, well, there can be some ambiguity with regards to the word harm, and there's obviously many ways in which you might be considered harming somebody, but it's not in a way that was actually a violation of the non-aggression principle. And then obviously we spoke about words like aggression, and again, like with regards to, like, the name Nations of Sanity with the movement, perhaps Nations of Peace would be more welcoming, and I thought that was quite a good point, because especially as obviously I present the Nations of Sanity presents the non-aggression principle, the whole idea of making it law through a peace agreement, and the idea that, you know, if we're ever going to have peace in the world, then, you know, this is kind of how you need to go about it, because it represents that universalizable principle. So yeah, and it's, I mean, I suppose I always went with sanity, just because I think that anything that's to oppose the non-aggression principle, I find it to be irrational. So I guess saying, you know, we're representing the non-aggression principle, so we're not representing utopia, we're not representing a perfect world, we're just representing sanity. But, you know, that can also sound a little bit insulting to people in many ways, because it's like you're saying, well, they're not sane if they don't accept this. So again, I think it's a balancing act, and as you say, people are so different, and we've all got you know, we've all got different history, we've all got different perceptions, we've all got different definitions that we apply to words, and I think that's why good faith is so important when we communicate with each other, because we make the effort to understand each other. And that's so important, because it can be so easy to misunderstand each other. And I also find that language is very limiting in many ways. Sometimes I, you know, wish we could just communicate telepathically, so we all know exactly what we mean, and, you know, it would all be a lot easier. But yeah. Well, we're coming close to an hour, so I'll probably better wrap up the conversation. But I just want to really appreciate the conversation. It was really very interesting. Although I know we kind of jumped back and forth with regards to your work with as a clinical psychologist, and also with regards to libertarianism, and obviously there's certain areas that don't really have a connection, but there is also, I find, a crossover, because a lot of what you were talking about, I mean, apart from what you were talking about with regards to overcoming stage fright, and that being very useful to me personally, but also with regards to understanding. I think your work also, and a lot of the stuff that I've seen, I think it's very important as well with regards to feeding empathy for people, and the ability to empathize with another person by understanding that we're complex emotional beings, that we see things differently. As you say, if we can find ways to break past the sort of our own mental barriers, and the way that we kind of make situations worse than they need to be because of the way we think about things, I think that does transpose over to when we talk about things like voluntarism and as a society, because I think a lot of the problems we have individually are reflected in society, and how dysfunctional we can be. So I think it's an important thing to marry up and understand the connection. So like I said, I just wanted to thank you for that work. Did you want to just mention as well, anyone else who wants to learn more about your work, where they can find out more?
Yes. I have a website, which is the same as the name of my book, 3minutetherapy.com, and 3 is spelled out. It's the word 3-Minute Therapy. I also have a podcast channel which on YouTube, which is called the REBT Advocates. I do it with my partner, Tommy Bateman, who's an REBT therapist as well. And I have on my website, I have many articles and a few chapters from my book. And and as you mentioned, Matthew, I have a book on stage fright and a book on general emotional problems, 3-Minute Therapy. And I also have a book on addictions, particularly alcohol addictions, and it's called Rational Drinking: How to Be Happy with or Without Alcohol. All of these are available on Amazon. And if I do phone and Skype therapy, so I do remote therapy. I have clients around the world, so I'd be happy to work with anyone in anywhere.
Excellent. Well, what I'll do is I'll put some links to this in the description of this video, so people can click on those. Obviously visit your YouTube channel. It was very interesting speaking to you. I really appreciate you taking the time, and hopefully we'll be able to speak again about both your work and about libertarianism and voluntarism and the non-aggression principle.
Yeah, thank you so much again for having me, Matthew. Thanks for all those great questions. I appreciate it.
Thank you very much, Michael. I appreciate you taking the time. Thank you.